And that is what a good provider will do for you. They will work with you looking at all those factors. And so how do we go about implementing everything that we talked about? First of all, you need a good evaluation by a healthcare provider. And I'm a physical therapist, so obviously I would prefer that you go to a physical therapist for this. But I realize that, that even though that I think is optimum, that may not be the possible, but that doesn't mean that I don't want you still to be able to get that. So anyone can work with you. Even a physical therapist who's never met a patient with FSH, they can work with you if they are willing to teach themselves about FSH, go to other sources that can help them learn about FSH, and are willing to hear what you have to say, because you know a lot about FSH. You made it your life to learn a lot about FSH, and they should be okay about learning from a patient. I learn a lot from my patients. Okay? So, as far as I'm concerned, those are the things you want to look for in your providers. They may not know much, but they're willing to learn, and they're willing to work with you. Okay? That is extremely important. So you get your recommendations, and you do your regular monitoring and adjustments. And whether, in the beginning it's once a month, you guys talk to each other by phone, go see them every 3 months. As you get better at listening to your body, taking charge of your program, they feel more comfortable that, yes, you've got the hang of what they want you to do. Maybe you only need to see them every 6 months. Drop them an email or a phone call when something happens that you're concerned about. So self-monitoring, I think, is very, very important. And as I said before, this is all teamwork. And I strongly believe that before you decide something works or doesn't work, you give it at least a trial of 3 months. Because it takes time for our bodies to adjust to anything new. And we need to give it time. We need to get used to the routine. Our body needs to get used to the routine before we write something off or we dive into it going forward. Again, as I said, start slow, low, make it part of your life. Okay, so that's where I'm going to stop about exercise and activities, and I'm happy to take questions about it now or finish a little bit more about assistive devices and then talk. What would people like? Go ahead. Okay, why don't we finish? So what kind of devices do people find helpful? One of the things that we know is, yes, FSH starts with the face, scapular girdle, but eventually the lower limbs are affected too. And in some people, actually, this may go into a plateau and the lower body gets affected sooner. For some people, it's the ankle dorsiflexors, the muscles that help us bring our foot up, becomes weak. For a small minority, it's the hips that get weak. So again, this is where we need to look at the individual. Is it the distal weakness? Is it the proximal weakness? In cases of distal weakness, there are devices or orthoses called ankle-foot orthoses. That's what the AFO stands for, ankle-foot orthoses, that might be able to help. You notice that, when you're walking, your foot just slaps on the ground, or you're catching on your toes and you're stumbling. Is there something that we can do to help that foot maintain its position? And depending, again, on the weakness, the knee, there are a whole set of devices, as simple as the first one here, to off-the-shelf, custom-made, carbon fiber, plastics, and a whole price range. And again, this is where you need to work with your individual clinic, your neuromuscular specialist, your orthopedic specialist, your rehab specialist, physical therapist, whoever's available. because they'll need to monitor, they'll need to see what your needs are, what kind of environment you're in, what's your day like, what the kind of footwear you're comfortable with, etc., and make joint decisions with you. When there's a need for something more than that, and we now have more problems walking, sometimes people find that younger people, don't want a cane. We use these longer canes, more like the hiking canes with them. There are what are called the love-strand crutches. There's regular canes, and for those that really find it difficult to go long distances, some of these devices where you can again sit down and rest, especially when you go to the mall or something, again become helpful. So there's a whole bunch of devices out there, and based on your status at a certain point in time, we would have to work on what is the ideal thing for you. And over time that may change as your needs change, and we may have to look at other things. We know that up to 15 to 20% of patients with FSH will eventually progress to where they might have difficulty walking, and we need to look at devices for the appropriate mobility, whether it's long distance, usually, or in the home. You have everything from lightweight, manual, foldable wheelchairs to scooters to motorized chairs. And how do you make a decision again? It all depends on where do you need it. Is it for a one-time trip to Disney World with the grandkids? Then hopefully there's an MDA loan closet that you can go to and get a device, or rent something for a week or 10 days when it's a more permanent need. These devices are nice. They are foldable, compact, go in the trunk of a car, but if you have shoulder weakness, who's going to help pull those out? Do you have someone in the family that can help you do that? Scooters are great, but the battery pack is fairly heavy. And again, yes, it can go in the trunk of a car, but you need help with someone getting it out for you to be able to use it. And the minute you talk a motorized chair, you're now talking a van, an adapted van, an adapted home. So you're talking a good over $50,000 investment. Because it's not just the chair, but adapting the home. A regular car won't do. You're talking a van and an adapted van. So again, depending on the needs, and it's not as much of an issue in this population as we see it in Duchenne dystrophy or amyotrophic lateral sclerosis or some of those other neuromuscular conditions where people are going to need these devices for a longer period of time. But again, it's the individual, it's their individual needs, individual circumstances, individual financial issues, all need to be taken into account when we talk about any devices, orthotics, etc., and what's appropriate for you. We need to think about your strength and functional abilities. As I said, caregiver assistance, environment, and cost. Okay? So these are the factors that go into when we think of any kind of assistive devices. Even those braces, we have wonderful carbon fiber braces now, but they cost a good chunk of money. Anything medical costs a good chunk of money. And even though you have the best insurance, and even if you only have a 20% copay, that 20% can be quite a large amount, depending on the cost of what we are talking about. So all these factors really need to be thought through when we make any decisions. So as I've said again and again, teamwork and partnership are essential for success. This is a long journey that we are embarking on together. And we hope that as physical therapists, we can play a role in helping you maintain the best life, quality of life, and function that you would like to achieve, and that we can be partners with you in that journey. Thank you.